So today I will be doing my presentation on osteoarthritis in the equine tarsus. So this is just some anatomy of the tarsal joint. We have the central tarsal bone, the third tarsal bone, the third metatarsal bone, and then we have the proximal intertarsal joint, distal intertarsal joint, and the tarsometatarsal joint. So the distal intertarsal joint and tarsometatarsal joint tend to be the joints that suffer the most from osteoarthritis, as the proximal intertarsal joint isn't usually affected. Osteoarthritis usually arises due to compression of the distal tarsal bones and due to cyclical loading and repetitive trauma. Fusion of these bones does eventually occur because of these excessive forces and causes a breakdown between in the joints of the articular cartilage. So here we have a nice little graphic depicting osteoarthritis in a joint, from a healthy joint on the left all the way to an arthritic joint on the right. On the left, in a healthy joint, we start with a nice large joint space, elastic synovial fluid that's quite thick and sticky, and we slowly degenerate into an arthritic joint where there's a very narrowed joint space. There's also the two bones that articulate in the joint will be rubbing and shearing against each other because of the loss of articular cartilage, and the synovial fluid will be very thin and not very sticky at all. You can also see the difference in the synovial membrane and the health of the synovial membrane, and you can understand why this would cause so much pain, especially in the hocks where the horse gets so much propulsion from during locomotion. So just going to go quickly over some clinical signs. So the biggest one is pain, but the nature of osteoarthritis is that it gradually builds over time. So often osteoarthritis will be misdiagnosed for things like proximal suspensory desmitis because of the suspensory ligament's proximity to the tarsus and its function to stabilize the tarsus as well. Skelly Smith, Island and Dyson suggest this purely because of the proximity of the suspensory ligament to the tarsus, and they looked at distal tarsal joint interosseous ligaments in comparison to osteoarthritis in the hock. Another clinical sign would be lameness, which Bressonian or de Gegier suggest often is bilateral. But also we have changes in the radiographs as well. So we have the blue arrow indicates a thinning of the joint space. We can also have osteophyte formation and subchondral bone sclerosis. The blue arrow here points to the distal intertarsal joint and shows the narrowing of the joint space, but also you can see there's a slight osteophyte formation there as well. Other things to look out for, risk factors, Gallio et al. 2014 suggest there's a positive correlation between tarsal osteoarthritis and body score and body weight. Also, there's a positive correlation between osteoarthritis in the tarsus and poor Heuck conformation. And these are just my references. So, osteoarthritis and kinetics. So naturally, if a horse is in pain because of an arthritic hock, the horse won't want to load that limb, especially during the weight-bearing portion of the stride, just to basically reduce pain. This naturally lowers the vertical ground reaction forces exerted on that limb, the affected limb. But these forces have to go somewhere, and this is compensated by the other three limbs. However, the rest of the forces aren't spread evenly amongst the rest of the three limbs. The point of zero moment is where the point where force is applied under the foot. Wilson and Weller, 2011, they indicate that an osteoarthritic hock the point of zero moment is spread across the lame hind limb more laterally and plantally, indicating that the horse does not want to load the hock in the medial aspect, indicating that there is pain associated with the medial aspect of an arthritic hock. This can be measured when you're measuring kinetics. It can be measured using force plates, and you can measure each limb as it crosses the force plate. And Keegan, 2011, who looked at lameness quantification, suggests that force plates are the best tool to be used during kinetics and gait analysis, because it gives you the most accurate view of weight bearing amongst the limbs at different gaits. So now we'll have a look at osteoarthritis and kinematics. So the kinematics of an osteoarthritic hock and the changes in gait in an osteoarthritic hock are quite well characterized by a shortened stride in the cranial phase of the movement before the limb moves medially in the flight phase, and then the limb is swung out laterally before the limb strikes the ground very hard. This whole movement can be described or characterized as circumduction of the hind limb. So rather the limb moving craniocaudally, the limb is actually moved lateromedially. Wilson and Weller, 2011, indicate that the movement of the limb as a whole is used to reduce loading in the medial aspect of the tarsal joint to reduce pain during the weight-bearing phase of locomotion. Furthermore, Heuck et al. 2008, who investigated the strategies used by horses to adapt to lameness, found that hind limb lameness, weight from the lame limb is often offloaded to the contralateral hind limb, indicating a risk for the contralateral limb to experience excessive forces and potentially succumb to osteoarthritis like the original hind limb. Also looking at measuring kinematics, Keegan, 2011, suggests that the best way to measure kinematics and gait analysis is using positional tracking of markers and a treadmill, although you can also use positional markers on the normal ground, but a treadmill gives more repeatable, accurate results. But to use with the treadmill and the positional tracking of the markers, you should use a video analysis software such as Kinetic. So in conclusion, we know that osteoarthritis is a degenerative disease and there's no known cure, not only just for horses but for dogs and humans as well. So the main aim of therapy is to reduce pain, reduce inflammation and increase range of movement. Schlachter and Lewis in 2016 indicates that extracorporeal shockwave therapy is a well indicated therapy for use in hock osteoarthritis, as it can quite easily traverse the hock laterally and medially and traverse across all the lumps and bumps of the hock, and it also has analgesic effects. Although results do show better results in the forelimb opposed to the hind limb. Frisbee et al. Though in 2009 found significant improvement in lameness following treatment with extracorporeal shockwave therapy, and this is probably attested to the reduction in pain, so the horse is more happy to weight bear or load the affected limb. Although there were no pathological changes found within the hock joint, such as changes in the synovial membrane or the health of the synovial membrane or the quality of the synovial fluid. Thank you for watching, and this is just my reference list. Should have 3 pages. Yep. Brilliant. Thank you.